As cases of the swine flu continue to rise, the U.S. issues a warning to travelers, and local health officials prepare for a possible outbreak. Good evening, and thanks for joining us tonight at 6 o'clock. I'm Mike Thompson.
And I'm Lisa Klein. The number of cases of the swine flu in the U.S. now stands at 40 in 5 states.
Most are New York City students who recently returned from a trip to Mexico. A number of schools across the country are taking extra precautions, hoping to prevent the virus from spreading. While President Obama says there's no reason for alarm, Americans are being told to avoid all non-essential travel to Mexico. Officials from the Centers for Disease Control and Prevention say they expect to see cases in other parts of the country and a broader range in terms of the severity of the infection.
Even though Wisconsin hasn't seen a case of the swine flu yet, local and state health officials say they're ready to handle an outbreak of the disease. News Channel 8's Laura Reed joins us now live in the studio to tell us what local health officials are doing to prevent the swine flu.
Well, hi, Lisa. State and local health officials say if we are to see an outbreak of the swine flu, they have a plan in place to make sure that people get the treatment they need. Preventative measures of that plan are already in place to make sure the number of cases stays at 0. Precautions are in place to keep the number of swine flu cases at 0 in Wisconsin.
Our degree of readiness is much greater. On the other hand, it is always a balance as to who is better, the bug or the public health.
Right now, officials are banking on public health. Friday night, officials put a plan into place to find potential carriers of the flu so that any cases can be caught and dealt with early.
We are really fortunate with this swine flu, as best we understand it, that the cases that have occurred here in the United States have all been really mild.
At any one time, there are about 250 different strains of the flu throughout the world, but the problem is they're constantly changing. So when something new emerges, like this strain of the swine flu, it takes health officials a while to figure out what they're dealing with.
What we're trying to figure out across the world is whether this particular strain of this particular kind of swine flu is more important than other kinds.
Until health officials understand more about how this virus works, how it spreads, and how it can be treated, doctors are asking people to keep a close eye on their symptoms. The two big things to keep in mind are a high fever, and if you've traveled to an affected area in the last 7 days or been in contact with someone else who's been in an affected area and is sick, talk to your doctor about getting tested.
Sometimes people confuse influenza with having diarrhea or throwing up. That's not what we're talking about. We're talking about a fever. We're talking about respiratory kinds of problems.
Doctors warn the annual flu shot you may have gotten earlier this year most likely won't prevent swine flu. However, some drugs like Tamiflu are thought to be successful in fighting the bug. Right now, swine flu doesn't appear to be any more serious than a normal strain of the flu, but health officials warn that it could change at any moment, and that's why they're keeping such a close eye on the situation.
All right, thank you, Laura. To prevent spreading the swine flu, or any other flu for that matter, doctors remind people to wash their hands frequently, cover your mouth when you cough or sneeze, stay home from work or school if you're feeling sick, and call your doctor to talk about your symptoms and to find out about testing. If you're interested in learning more about the Wisconsin's emergency plan, log on to WKBT.com, where you'll find a link to the state's website. Right now, Minnesota is still in the clear as well. There are no confirmed cases of swine flu in that state either.
There's a lot of talk about swine flu right now, and we want to make sure you're getting the right information. That's why we're bringing in health professionals from the La Crosse County Health Department for a live question and answer blog session on our website. It's called Swine Flu Q&A, and it'll take place from 5 until 6:30 tomorrow night on our website, WKBT.com. Now, you can ask health professionals questions directly and get their answers live on that blog. Again, it starts at 5 and runs until 6:30 tomorrow night on WKBT.com.